Hi, I'm Dr. Patrick Denard. I'm an orthopedic surgeon with over 10 years of experience, and I'm founder of the Thrive Protocol. And I'm going to talk about nutrition in surgical patients, in particular in this presentation, how there's relevance to cost savings for hospital systems and ASCs as well. So hospitals and health systems have a lot of metrics they have to pay attention to: quality indicators, patient satisfaction, financial, length of stay, mortality, and readmission. And there's a lot of pressure on health systems at this current point in time. There's reimbursement compression. At the same time, there are rising expenses with labor costs and drug costs going up. And then there are also metrics. So there's a lot of scrutiny. And then lastly, there's elective surgery competition with ASCs, especially in hospitals, and that's creating a big problem for hospitals in particular. So I'm going to talk about some of the relevance of nutritional deficiencies. Now, first off, nutritional deficiencies are very common. Various studies have looked at this: 65% perhaps of all surgical patients, 50% of total joint patients, 20% of shoulder arthroplasty, and 90% of bariatric patients. And this isn't just the elderly. In fact, it's not just the older population. In fact, younger individuals also have nutritional deficiency. Interestingly, even though people are made aware of this, they usually decline a consultation. So we really have to raise awareness and look at this across all populations from age ranges and different backgrounds. So I'm going to dive into some of the impact on the outcomes in terms of nutrition and surgery. So malnutrition doubles the risk of complication. This is a large study from Germany looking at over 1,200 elective surgical patients across multiple specialties, so things like general surgery and orthopedics. And essentially what they found is that the complication rate rose, length of stay doubled, and again, 50% of patients were considered at risk. Now, if you look at this in total joint replacement literature, in particular total hip arthroplasty, this is a review of 500,000 patients, and the differences are quite striking. Those who have malnutrition have a much higher risk of non-home discharge, 30-day readmission, and various complications, including pulmonary complications, reoperations, and even a 105% increased rate of mortality in the setting of nutritional deficiency. And if you look at total hip and total knee arthroplasty from large claims database and look at all the factors, things like tobacco use, diabetes, opioid dependence, actually malnutrition is a bigger risk factor for readmission than any of those factors. So we commonly as surgeons talk about managing diabetes and creating guidelines, for instance, HA1C, but it turns out nutrition is really the biggest factor perhaps that we should be looking at. And it's not only readmission, but data also shows that if you have malnutrition, you have a much higher risk of surgical site infection and periprosthetic joint infections. They're 260 and 340% respectively. These are huge findings because this is something that people are watching at or looking at in terms of metrics from the national side of things. And also it's a major complication or devastating problem for the patient when this occurs. This isn't just total hip. This data really is consistent across all specialties. There's data in hip fracture, spine fusion, colorectal. In fact, much of the early literature comes out of the general surgery literature where they really looked at this and found major differences. And there's also been studies that have looked at this from terms of coronary artery bypass. The key thing here is that nutrition can be optimized. So I want to talk about principles including protein, carbohydrate loading, and then touch on micronutrients and how this can be impactful in terms of outcomes. So one of the things, whether it's orthopedic surgery or any type of surgery, general surgery, there's often immobilization. That immobilization leads to rapid muscle loss when you do not offset with supplementation. 7 days of immobilization decreases strength by 8 to 21%. 5-day bed rest has been shown in studies to be equivalent to 5 years of aging. The opportunity now here is to intervene and take that recovery curve and shorten it. In other words, you want to bounce people back quicker. And the key there is that protein requirements double after surgery. So most people don't recognize that. Patients will often say, I eat well, but actually they need to be informed that they actually have a much higher requirement in the post-surgical period. And if we intervene there with protein and amino acids in particular, that's where the opportunity for improvement comes in. So one of the early studies looked at leucine, and leucine is the key amino acid in muscle synthesis. And this was a study looking at individuals ages the age of 45 and 60. They bed rested those individuals. Yes, they got them to sit in bed for a couple of weeks, giving them a regular diet versus giving them leucine, 3 grams a couple of times a day. And in the leucine group, they had much less muscle loss and greater lean mass preservation. Then that basic science has been taken into other studies looking at clinical outcomes. For instance, hip fracture data here with supplementation with HMB, which is essentially very close to leucine as well as protein in this particular study, found that those who were supplemented had 81% greater mobility at day 15, and they healed faster. On average, wound healing was a day faster, and that's actually quite substantial. Randomized controlled trial data from total knee arthroplasty looking at amino acid supplementation 1 week prior and only 2 weeks after the operation has found that people have greater strength, in fact, 2 years after surgery. Now, this is really interesting because what this suggests is that it's not just this period where people are going to get it back. In other words, there appears to be a critical window in which if people are given supplementation, they do better long term. This study has been echoed in another study out of actually Eugene, Oregon, and here they found that muscle strength was greater in terms of the quadricep volume preservation in those people who were given amino acids. And yet another study here from Japan, again, showed improvement in strength. So all this data in summary shows that nutritional risk factors are very common across all specialties, but especially in total joint arthroplasty. And if you give supplementation, there is opportunity for improvement in terms of their outcomes. I want to move over to carbohydrate loading next. Now, the traditional approach to eating before surgery is 12 to 16 hours NPO. So we say nothing to eat or drink after midnight. And what that leads to is people often don't eat or drink for 12 to 16 hours. In fact, data shows it's 16 hours on average. This leads to increased catabolism, which subsequently creates increased insulin resistance and free radical production. In other words, it's a downward spiral. So if you give carbohydrate loading the night prior, the idea is just like an athlete prepares for an event, you want to give that patient the energy so their body has the immediate glycogen stores to get through an event. And you can do that the night before. And then some facilities, based on the ERAS protocols, will do that 2 hours prior to surgery as well. That varies by facility. Cochrane review data shows that by using that approach simply alone, even without protein, you have decreased length of stay. There's also suggestion that you get decreased muscle loss as well. If we look at the evidence in terms of total joint arthroplasty, the data here is quite supportive of this concept as well. We see decreased length of stay, less pain, and also in the postoperative period, people actually have not only decreased insulin resistance, but as a consequence, they have decreased hunger and anxiety and shorter time to have bowel movement. All that leads to shorter hospital stay to facilitate the patient getting out in a more quick manner. I want to move on next to micronutrients. So there's a lot of data that suggests that simple vitamins play a large role in recovery. So vitamin D is a critical modifiable deficiency. It's actually present in about 75% of patients undergoing total joint arthroplasty, and there's a seasonal variation, so it gets worse in the wintertime. And if you look at a study of 150,000 patients, you see that vitamin D deficiency is associated with increased length of stay, and supplementation improved outcomes in 6 of 10 studies. So this is a simple tool that can be used to improve outcomes in total joint arthroplasty. Vitamin C is another one. Vitamin C plays a critical role in collagen. It's also been shown in multiple studies to reduce pain and inflammation. Even in one study, it's been shown to reduce blood loss, which is quite interesting, taking something as simple as vitamin C 500 twice a day and leading to such a profound impact on outcomes. In addition to those big ones, there's some other micronutrients that have suggested to have evidence in improving outcomes in the surgical field. Collagen, for instance, was one that I was a little bit skeptical to begin with, but it turns out that collagen supplementation, especially after exercise, leads to increased thickness. If you think about This makes a lot of sense for people undergoing surgery where tendons are disrupted, such as going through the patella tendon with a total knee arthroplasty. So giving collagen supplementation can help that patient recover. Curcumin has been shown in double-blind randomized controlled trial of laparoscopic cholecystectomy patients to actually lead to decreased inflammation, less pain at 2 weeks, and improvement in adhesions, so lower rates of adhesions. And then omega-3 fatty acids are well known for their cardioprotective effects, but have also been shown to lead to decreased inflammation in the postoperative period, and especially in cardiac patients, that's been shown, but also in the immobilization setting, which is relevant to surgical recovery. It's been shown that if people are given omega-3 supplementation, they actually have less muscle loss. So there's a muscle preserving effect of omegas. The real key thing here is, okay, can you take all of this stuff individually and actually give people guidance and have them improve their outcomes? And a large study came out recently in 2024 looking at this and essentially looked at nutritional guidance, psychological guidance, and physical guidance, and found specifically if you look at nutritional guidance, you have a 38% reduction of complication and a 1-day length of stay reduction. So simply by giving patients information and ideally then supplementing them with a product that gives them an easy pathway, you can indeed intervene and improve outcomes. And it's not just that you can improve outcomes, but patients are actually looking at this. They are wanting to know what to take. So this is a study looking at total joint arthroplasty. And patients generally say, I really don't know what to take, but in fact, if a surgeon or system gave me guidance, I would purchase a kit even if necessary. And I think that's quite profound. So there's a large gap that's occurring between what patients are delivered in terms of information and what they are seeking. And much of that has to do with the pressures in healthcare, but we need to do a better job of meeting them where they are seeking information. Now, the challenge to this is that I've now outlined many factors that can be important in improving surgical outcomes from a nutritional standpoint. But the problem is if you're trying to give people a lot of different things, it can be hard for them to put that together. That can lead to confusion, which is will then subsequently lead to decreased compliance. And also, if you want to take a large spectrum nutritional program, oftentimes that's associated with cost. So the solution, in my view, is to provide nutritional kits that are simple and easy to use, that makes it very easy for the patient to take once or twice a day with clear instructions that will improve compliance, but also serve that gap that is there. Now, if we look at the impact of such intervention, there was a study that was presented at the American College of Surgeons in 2024. This was performed at the Allegheny Health Center. This is 4,000 patients that they looked at across 8 surgical specialties. They found that if they gave a nutritional intervention consisting of proteins similar to what I've described, as well as carbohydrate loading, they had an 18% reduction in length of stay, 33% reduction in complications, and what's really profound is the ROI, or return on investment. The program in their particular facility cost $250,000 a year, but it led to nearly $8 million in savings, and that's really just in all that decreased length of stay, patients getting out quicker. And I imagine this is going to get even more profound as penalties start coming from CMS as a result of complications that are occurring in patients. So if we can lower those, that leads to even greater cost savings. So how do we approach this with the Thrive protocol? What we provide is OptiFuel, which is a protein supplement, which includes high leucine, which is very important. The clinical dose of leucine is 3 grams, and that is more than you will find on the off-the-shelf protein product. So you want to meet that need. We've added collagen as well, and additionally omegas, curcumin, vitamin C, vitamin D, and magnesium. All of these are designed to combine to support the surgical patient where their needs are. We also provide a carbohydrate drink that's used the night prior to surgery to provide that important carbohydrate loading, as well as electrolytes in that for hydration so patients don't come into the surgical setting dehydrated. Now, this is really simple to use. We follow the simple guidelines that were given in some of those earlier studies. So the idea is that people load in advance, do carbohydrate loading the night prior, and then continue afterwards. Now, that said, there is some data and studies that show, or at least look at, just simply taking high protein after surgery, and that's beneficial. So it's not mandatory that loading is done in advance, but we believe that makes sense to sort of build up the body and then be ready for recovery after surgery and meet the needs of that patient. All the products we have are third-party tested, informed sport tested. This ensures that accuracy is there, there's no contaminants, and it's also a surgeon formed company. So it's really coming from surgeons who are looking at this and saying, here's how we want to benefit our patients. In addition, we provide website and patient resources such as healthy recipes and blogs about recovery in general to give them resources that they can go to help get through the process. We have social media presence, which gives patients the ability to look at some quick information, which we know a lot of people are going to for their health information now, and then direct delivery to the patient if desired. This really leads up to a win-win for the patients. It's improved clinical outcomes, improved satisfaction. This empowers them in their surgical preparation and recovery, we believe. And for hospital systems, it leads to less length of stay, decreased readmissions, improved quality metrics, and I think a marketing differentiator, especially in a competitive environment where you can provide patients a tool and really show them that you're looking at the whole picture. So again, really a win-win. Our value proposition for hospital systems is that this sort of approach provides cost savings. It's evidence-based. We have a patient experience that's improved, and then flexible procurement from us. So I really encourage you to take this information and look at your health system, and we would be happy to chat with anybody about how we can partner to help improve your metrics and also the patient experience. Thank you.